On Tuesday, 22 March, China shut down the industrial city of 9 million people overnight and reported more than 4,000 cases of the virus. Ladies and gentlemen, welcome to our YouTube channel. Today, we are going to talk about China's failed COVID policy. Health authorities have reported 4,770 new infections across the country, mostly in the northeastern province of Jilin, as the city of Shenyang in neighboring Liaoning province was ordered into lockdown late Monday. China has acted swiftly in recent weeks to crush virus clusters, with a combination of local lockdowns, mass testing and citywide lockdowns. He reported 2 deaths from COVID-19 on Saturday, the first in more than a year. Authorities have warned of growth risks from a permanent lockdown, as the country tries to balance the health crisis with the needs of the world's second-largest economy. Shenyang, an industrial hub that houses factories including automaker BMW, announced 47 new cases on Tuesday, as authorities placed all housing developments under closed management and barred residents from leaving without a 48-hour test. Last week, Chinese President Xi Jinping stressed the need to minimize the impact of the pandemic on the Chinese economy, but also urged officials to maintain the current zero-COVID approach. But books on the virus in Beijing have been pushed to their limits by Omicron's latest jump, which has forced authorities to vacate hospital beds of patients with mild symptoms. Some cities, such as Shanghai, have avoided complete blockades, instead of imposing a network of blockades on individual buildings, even as new asymptomatic infections jump into the hundreds each day. Jilin provincial officials said Monday that the first 10,000 doses of Pfizer's oral COVID drug arrived on Sunday, marking the first time Paxlovid has been used in China. Last week, the province imposed strict travel restrictions, barring residents from leaving their towns and counties, while several cities have closed their homes. The Shenzhen Southern Tech Center Monday announced it would lift its week-long lockdown in an orderly manner, after partially easing measures on Friday, to minimize the impact of containing the virus on factories and ports. Health officials announced last week that only about half of Chinese people over the age of 80 had been vaccinated twice, as the specter of Hong Kong's dire death rate from COVID, mostly among unvaccinated older people, overshadowed decision-making in Beijing.